Hi there, and welcome to the channel. My name is Dr. John Durrani, and today in this video we're going to talk about concussion. So the first question is, what is a concussion? And a concussion can also be called a traumatic brain injury. And a concussion is the most common type of traumatic brain injury. And it's a type of brain injury that occurs when someone injures their head. And one of the most common questions we get is whether or not you can get a concussion if you don't hit your head. And the answer is yes. If you do get a concussion, you don't necessarily have to hit your head. If you even get your head rattled around enough where you get the symptoms of a concussion, more than likely you probably had a concussion. And generally speaking, if you do hit your head hard enough, you usually will have had a concussion. Another very common question we get about concussion or traumatic brain injuries is, does someone always pass out? When someone has a concussion, they may or may not lose consciousness or pass out. However, the more severe a concussion is, the more likely someone will lose consciousness. The next question is, how common are concussions? And the most recent statistics show that a concussion happens almost every 21 seconds in the United States. And another study showed that 88% of concussions are missed. So what are some activities that increase the risk of a concussion? So one of the biggest things that increases the risk of a concussion is playing contact sports. And these would be sports like football and soccer, because you can get knocked down during those sports. You can get your head hit. Someone can hit your head in soccer. They can headbutt the ball. There's a lot of different ways during those types of contact sports where if someone gets knocked down or gets hit in the head, they can certainly suffer a concussion. Another way that someone can get a concussion is they have the lack of a proper safety gear in contact sports. So not wearing their helmet when they're playing contact sports is a huge thing that can definitely increase the risk of getting a concussion. Car accidents, motorcycle accidents, or bicycle accidents that can cause a head injury are events that really increase the risk of getting a concussion. Certainly, the higher the speed of a car accident, the greater the risk of getting a concussion is, as well as when someone is in a motorcycle accident, that certainly increases the risk of getting a concussion. And if they don't have a helmet on, that greatly increases their risk of getting a concussion. And in a bicycle accident, especially one without a helmet, that greatly increases your risk of having a concussion. Another activity that increases the risk of a concussion is being hit with an object, and that could be anything that falls down or is thrown at someone, anything that would make direct contact to someone's head. And having a previous concussion does increase your risk of having another one. So what are some common symptoms of a concussion? Well, after a concussion, someone can almost immediately feel confused. A lot of times patients complain of feeling dazed. They don't feel quite right. They feel off. Patients complain of clumsiness. They just don't have quite the same movement with their hands. They notice that they have slurred speech, so they aren't getting their words out as well as they normally would. And many patients complain of nausea and vomiting. And you can have nausea or you can have vomiting. Generally, if you have vomiting, you usually have nausea associated with it. Some other symptoms of concussion are headaches, and these can occur right after the concussion. They can occur hours after concussion or weeks. We have patients complain of balance problems, so when they get up, they feel unsteady, or when they're walking, they feel unsteady. We have patients that complain of dizziness after a concussion, so they feel like the whole room is spinning around them. Patients definitely can experience blurred vision, so when they look far away or when they look close up, their vision is sometimes blurry or has a halo around it. It can be as bad as to a point where they have double vision. Many patients notice that they have a sensitivity to light. So when they're out in the sunlight or to fluorescent lights or just bright lights in general, that can be problematic for them, and they just don't feel well when they're exposed to that kind of light, or we could say stimuli. What are some other symptoms of concussion? So many patients can experience sensitivity to noise. So if there's loud noises going on, noises in the background, very large spikes in noises from quiet, that can be very bothersome and irritative to them. Patients have noticed ringing in their ears. It could be on one ear, both ears. It can alternate. Many patients describe irritability and just don't feel themselves. Many times their family members notice this. They notice that their personality has some changes to it. They're short-tempered. And as we kind of just said, with personality changes, sometimes the patient notices it. Sometimes the patient's family members notice the personality changes. And, shortness of temper is one, grumpiness, forgetfulness, being late to things, just various changes in their personality that they didn't have before the concussion. We've seen patients who were very carefree and happy-go-lucky change into very depressed individuals from a concussion. And a concussion can also cause difficulty concentrating. So they have problems doing homework, problems doing work, problems doing schoolwork, concentrating on computers, concentrating on their books. They have to take frequent rests when they're working or doing their homework. When they're taking tests, they're having more difficulty. And so we kind of see that across the board in any sort of activity that requires concentration. Patients can have a lot of difficulty with that after a concussion. To continue our talk about the symptoms of concussion, patients have noticed and can notice memory loss. So many times they have issues with their short-term memory. They can forget conversations that they had 5 minutes prior. They can forget what they did the day before. Sometimes they notice it. Many times their family members or their coworkers notice that they're just not remembering as well as they used to. Patients also notice that they have a lot of fatigue. They just feel tired all the time, and they just have a difficulty kind of getting up and moving. And the fatigue can vary throughout the day. It certainly can be worse in the morning or at night or in the middle of the afternoon. Everybody's a little different as far as how they experience the fatigue, but that definitely can be caused from a concussion. We also notice that patients have difficulty with sleeping. So even though they're very fatigued during the day, when it actually comes time to go to sleep, they notice that they're having a hard time falling asleep and staying asleep. Many times they'll have a insomnia type of feeling where they just feel like they can't sleep well or they can't fall asleep. And many times when they're sleeping, they wake up for no reason many times throughout the night. So you would think that even though they're fatigued during the day, they would be able to sleep at night, but they actually have the reverse problem. And the problem is that when they're having difficulty falling asleep, then they don't get very good rest, and then their fatigue gets worse throughout the day. Definitely after a concussion, patients can develop depression, they can develop anxiety, they can develop both. This is definitely in line with the personality changes we can see as well. Many times the patient may notice they feel depressed or anxious. The family members may notice that the patient looks depressed or feels depressed, or they may say things like they feel down. This happens rather frequently with concussion, and the more severe the concussion is, the more frequently we see that. Another big symptom that we can see with more severe concussions is changes in taste or smell. And basically, the patient really doesn't taste things as well as they used to, or they notice smells much differently than they used to. Sometimes this improves with time, sometimes it doesn't. Everybody's a little different as far as with their changes in taste and smell. So how do we rate concussions? There's been many different kinds of scales to rate concussions over the years, but generally speaking, we use the American Academy of Neurology's grading scale, which grades the concussion from grades 1 through 3. In a grade 1 concussion, this is considered a mild concussion. And with a grade 1 concussion, the symptoms generally last less than 15 minutes. And with this type of concussion, there is no loss of consciousness. With a grade 2 concussion, this is considered a moderate concussion, and the symptoms last more than 15 minutes, but there is no loss of consciousness with a grade 2 concussion. With a grade 3 concussion, this is considered a severe concussion, and with a grade 3 or severe concussion, there is a loss of consciousness, and it can be only for a few seconds or it can be for minutes. So long as the person loses consciousness for even a few seconds, that gets deemed into the severe category. Now, whether someone has a grade 1, which is a mild concussion, a grade 2, which is a moderate concussion, or a grade 3, which is a severe concussion, many times it is correlative, meaning that the symptoms that they have are typically equal to the type of concussion they had. So if they had a mild concussion, they usually have mild symptoms. If they have a severe concussion, they have severe symptoms. However, that's not always the case, but generally speaking, that is what we tend to see. Something that's very important to understand about concussions is there's this phenomenon called second impact syndrome. And after a concussion, if someone has another concussion in a short amount of time, after the previous one, they can have a condition called second impact syndrome. This has been reported in the news several times, especially as there's been more awareness to concussion, and there's been young athletes that have died from it. And what happens is that someone gets another concussion in a short time period after the previous one, and it causes severe brain swelling after it and can lead to death. And it's very rare, but it does happen. So it's something that's very important to identify the first concussion and to have that rest after the first one to avoid this syndrome called second impact syndrome. So what happens after a concussion? So generally speaking, most people recover from a concussion in a few hours to a few weeks. Usually the symptoms are self-limiting, meaning they stop on their own and they go away. So how can I avoid concussions? Well, one of the biggest things is wearing a helmet, such as when you're riding a motorcycle or riding a bicycle, or if you're playing contact sports that require a helmet. That can really cut down on the amount of concussions. There's more and more research being done about helmet technology, and they're working towards making even better helmets that help reduce both the frequency, so the amount of times they happen, as well as the severity, so how bad the concussion is. They want to incorporate that technology into helmets to help reduce the amount of concussions that athletes are having. Wearing a seatbelt really can help prevent a concussion, because in the event of a motor vehicle accident, the person isn't thrown around in the car, and when a person does get thrown around in a car in a motor vehicle accident, that greatly increases the risk of having a concussion. Reducing the risk of falls at home, and that can be something like removing throw rugs, especially if you have balance issues, because you can get tripped on those and then fall down and hit your head. Having things on the floor that increase risk of falls. Anything that can really increase the risk of falling can increase the risk of concussion. And exercising regularly actually helps improve your balance. So that also helps reduce your risk of concussion, because if your balance is better, you're much less likely to fall, and so your risk of a concussion goes down. So what happens if someone has multiple concussions? Well, there's a concept called a cumulative effect with concussions. What that means is that when someone has a concussion, it becomes additive. So if they had a mild concussion before, and then they have another mild concussion again later on, the symptoms of that second concussion will be much worse than they were with the first one, even if that second concussion wasn't nearly as bad as the first one. And as patients have more concussions, their symptoms generally tend to increase, both how bad the symptoms are, but also how often they occur and the severity of them. And we see this with professional athletes when they have multiple concussions over their career. The consecutive concussions tend to be worse than the previous ones. So essentially, it means that each concussion makes the brain worse than the last one and makes the brain take longer to heal and also causes the symptoms to be much worse. I hope you enjoyed our talk about concussions, and I look forward to bringing you more content. Thank you for watching, and please like and subscribe.